friends. Welcome to day 6 of brand 10,000 W Combinator 100 Days to Leadership Transformation series. On GCPAD, I extend a very warm welcome to all of you to this wonderful evening. We had great speakers and great topics in the last 4 days. We had sessions on cybersecurity, how to manage your finances, how to handle stress in business through a dancer's perspective. We had a session on power posing your way to confidence. And yesterday we had a session on innovation. Hope you all are enjoying these sessions. We know that we are all going through the same situation, and we want you to come out of this sad and depressing thoughts about the pandemic, and we want you to adapt to the new normal. And that's why GCPAD is bringing different speakers from different parts of the world to help you see and know and learn that we are all together in this, and we are there to support you to bounce back. GCPAD is bringing you the best way to connect with people from different parts of the world and also to network globally. We also have our energetic audience joining us from New York, Scotland, Tunisia, South Africa, Nigeria, Ghana, Kenya, Italy, Poland, Malaysia, Switzerland, and also we have people from Dubai and other places in the Middle East. I'm joining from Oman, and our today's speaker is joining us all the way from Charlotte. Before introducing the speaker, let me introduce myself. I'm Aparna G. Kumar, the Global Co-Chairperson of GCPAD, that is the Global Council for the Promotion of International Trade, a not-for-profit registered in India and South Africa. The mission of GCPAD is to handhold, empower, and support SMEs globally. As we all know, we are losing many lives to breast cancer and other types of cancer due to taboo, ignorance, lack of awareness, leading to late detection, inaccessibility to healthcare facilities, accurate diagnosis, and treatment management. The pandemic has made the scenario grimmer. We have a very special person, an expert with us today to talk about this topic. She is the founder and president, Breast Cancer Hub. She is an MBA from Northwestern Kellogg School of Management, who resigned from her career to create and grow Breast Cancer Hub as a full-time pro bono humanitarian service with a dream to save lives by making impactful, sustainable changes, working at the grassroots level by bridging the gap between the developed and the developing countries. Recipient of many awards, recipient of many awards, scientific publications, press releases, and known as the savior of women with breast cancer. Please join us as she talks about how she's driving a change and making an impact by saving innumerable lives. Let me proudly present before you Dr. Lopamudra Das Roy, and over to you, Lopa. I'm so proud of what you are doing, and we are really, really glad that you are with us today. Over to you.
Thank you. Thank you so much, Aparna. Thank you, Mr. Santoshi. Thank you, Rita, and everyone, the organizing committee, for this great initiative, which is so much needed at this moment and at this time of crisis. And without further delay, I would like to share my presentation so that, I can walk you through how we are trying to make the sustainable changes, with breast cancer and other types of cancer, combating the challenges. So taking you back a little bit to my childhood. So though I'm right now in Charlotte in North Carolina, but I grew up in Assam in northeast part of India. And I was 12 years old, and one of my friend's mom passed away. When I went for the funeral, when I asked, like, how did this happen, to utter the word cancer, it was a huge taboo. So when I went deeper and asked further, they just told me, like, what type of cancer? They said breast cancer. I said, breast cancer? I'm not supposed to talk about it. So coming from a family of physicians, like, I grew up in this environment where my dad, my grandfather at the dining table, we discussed everything. So this was a huge impact on me, like a shock for me, going outside the wall of the house, this was existing. So over the years, again, I realized that cancer became a household name, like a death sentence. Whenever I would hear that someone detected with cancer, it would be like, the person is going to die, which is not true, because early detection saves lives. And knowing this thing going on, I really wanted to understand the mechanism, the signaling pathway, the therapies, how to cure cancer. And that's how I dwelled into this whole, with the profession of being a scientist as a profession. But when I was doing this, I realized that, still, like I would go for the conferences in India or even in the US, many women were dying because of, how mammograms, which is the screening process, these are the challenges. I'll bring it up today in today's discussion, how mammograms can also miss tumors, which is still not known in the US. And also men get breast cancer. So these things, and in India, when I would travel and for the conferences or any developing countries, oncologists would tell me how women still present so late. And to further, to extend this, the inaccessibility to healthcare resources because of the scenario, the poverty and all of that. So it was always kind of building up in me, and then that's how in 2017 I felt that there are simple solutions which can save lives, and we are totally ignoring that. So that's when I started the new chapter of Breast Cancer Hub. And I would like to start with a tribute. She is Lotika Das, and we lost her in 2018. So when one of my friends, she's one of my friend's sister-in-law. So when he went to discuss with her, you know what she said? So we always know that taboo. With breast, the word taboo, that women do not want to speak about it, is the shyness. But from the many interviews that I have taken, like from Manjeet, from others, who we lost now, they said they did not know. They were not aware that a painless or painful lump could be cancer. So that is the ignorance, and whose responsibility is it? It is our responsibility to translate the information. That's why the awareness is so important. The right education, not this WhatsApp forwarded messages, like the correct protocol to bring it forward to the common people, to everyone in simple languages, in layman terms. Now, I also want to talk a little bit about another scenario, which when I was first talking in India, 99%, men and women were not even aware that men get breast cancer too. Even in the US also, it's a huge challenge because for men, they think it's a woman's disease and they're more shy to talk about it. I know men who committed suicide because they had a lump in the breast, breast cancer. I know men who told me that their kids, their own children, didn't want to tell to their friends that my dad has breast cancer because their friends are going to make fun of them. So how sad this can be, right? And then how early can this happen? So you see here Brett Miller, he's the founder of Male Breast Cancer Coalition, and we collaborate with MBCC. And Brett felt the lump at the age of 18. So that's why it's so important that early detection plus, the awareness needs to be earlier at the age, which we miss out. How many of us over here, even our like those our women in the family, how many of us actually have gone for screening? Not like for the diagnostic. Screening means when we have no problems, we go for clinical breast exam, or X-ray of the breast or ultrasound of the breast. Diagnostic is when we are having issues, and that's what the problem is. It's very important that we do the screening of the breast cancer for the men also and the women also. Now here we see Marlene's picture, right? So Marlene, he was the principal of a school. He was fighting for breast cancer for women, but he did not know that he also had breast cancer. So when it was detected, it was too late and we lost him. The reason why I bring it up, so when I first started Breast Cancer Hub, there were a lot of resistance. A lot of times, even women and men from India, from US, they said, Lopa, this is only needed in the villages. You don't need our people, we are so aware. Sometimes I feel that it's difficult to translate information to the educated population, but the villagers, who do not understand anything, it's so easy, they grasp it so well. That's why I bring up the picture, the scenario where irrespective of education, irrespective of socioeconomic conditions, situation is grim. And we need to really work on that. But how do we do that? So that's when I started to go more deeper, doing interviews, real-time interviews. Why are these women who are educated still detected with stage 3 or 4? Where with breast cancer, the stages are stage 0, stage 1, stage 2, stage 3, stage 4, and then mostly like stage 3, A, B, C. So what are the What are the fundamental reasons going on? So when I went through, I realized that, like, for example, this woman here, she was doing homeopathy for 1 year because even when she felt the lump, the doctor said, you need to come back to me. She did not go. So that's how the cancer from stage 1, it progressed to stage 3. Many women, they do, or with any type of cancer, we are doing Ayurveda, we are doing homeopathy. I'm not against any of that. I totally support that. But when cancer strikes, we need to take the tumor out. And then, like, because no study is being done that in parallel also, if we are doing the treatment, how is going to affect the cross reactivity? Because the potential of the traditional treatment of surgery, of chemotherapy, of radiation, the efficacy may decrease. So I would always request that this is very important. This is a huge, like roadblock that I face is we need to be transparent with our oncologist, even when detected with cancer. We cannot take other treatments in parallel. We can take all of that. Once as a, if we're having some side effects of the main treatment, then we can take some of the, like the supplements, but then that cannot be our primary treatment. So, and also we can dwell into that once we finish our treatment. That will help with the prevention. But once it happens, we really have to go to the conventional treatment, which is very important. That's why many moms we are losing because they do not do that. And on the other hand, these two women who are so amazing, they told me like this, in the local language, like, I didn't even know what cancer is. I felt this lump for a long time. My daughter just accidentally touched my breast. So, so this is how they got detected, but they are survivors. You can see all of them detected at stage 3. Even when we detect the breast cancer at stage 3, women survive, men survive. Stage 4 is when it becomes very difficult to cure. That means from the breast, the cancer has spread to the distant organs. And we get a lot of time for that. But that's why we have to address early, even with stage 3. So their interviews are all posted on our website because they are the inspiration, and they themselves tell us like what actually went wrong. Now, so what happened? So what is the first strategy that I did with the transformation? The thing is break the breast taboo. We have to openly discuss about breast health because breast is just another organ. Like, and like a lot of times I went to this so many conservative places in India, or I'm being told many times by many, like if I'm invited, I said, look, Dr. Please don't mention about the breast self exam card. Don't, because we have very conservative people in the forum. They are all educated, but still they don't want to listen to this. Then I said, then please don't invite me over the forum, because I have to talk about it because we have lost so many lives we can't do anymore because we do not discuss. Breast is just another organ. Like my dad, he used to be an advocate for breast milk all the time. So I always heard my dad saying that, breast milk gives the best immunity. The moms need to really work on the breast milk, feeding the baby. So I always tell everyone, if anything goes wrong in the breast, why are the moms so shy to talk about it? And now even the men get it too. So we know that. So there's no need to shy. So we have to openly discuss because breast cancer, when detected early and treated correctly, that's another challenge is we need to know how the treatment protocol persists. And that's where we also step in that because it is curable, it is very much curable when detected early and treated correctly. So how do we do that, right? So what is the mechanism? So basically with the breast cancer screening, we have to start doing breast self-examination from the age of 17 or 18. And how we came to this solution, I'll tell you in the next slide. But the other proper protocols are from the age of 40, we need to go for mammogram, which is the X-ray of the breast. Now, mammogram has challenges. I'll talk about it in another few slides. But from the age of 40 and 44, women have the option of doing screening mammogram. From 45 to 54, we have to go for mammogram every year. And 55 and older, we have to switch to mammogram every other year. But mammograms can miss tumors. What can we do? That is another challenge. I'll talk about it. But just please know by now that we really have to tell. Even I tell the sons that please talk to your moms. I know doctors who are sons who told me that my mom, me being a doctor, my mom was too shy to tell me that she was having this lump in the breast. And that interview is posted on the website. This was in Dibrugarh at ICMR. So please, even I request the sons, I request the husband, I request the dad, talk to your spouse, talk to your partner, talk to your daughter, talk to your sister. There's no need to be shy anymore because, each life matters for us. Now, what happens to the younger women? Another problem that we are seeing globally is earlier it was that, so as I said, right, the screening starts from the age of 40, but younger women are getting breast cancer too, globally. So what are we supposed to do for that? So that also we are going to address here, which we bring a solution to. So what is the solution? Breast self-examination. So what I thought was, very important was when I first thought, okay, now I'm going to go to India, I'll be going to the urban India, rural India. But if I go and tell everyone that please go for, screening mammogram, even in urban India, women told me, even my mom is hesitant, even though she's educated. She would say, no, it's in a cancer center. I don't have cancer. I don't want to go there for a mammogram. And I cannot fight this culture induced inertia, but I cannot blame anyone too, because that's how we grew up. So we have to think of an alternative. And that's when I felt that I worked with the oncologist here and with Male Breast Cancer Coalition. And we developed in simple steps, breast self-exam card, one side for women, and for the first time, one side for men. And now the next situation was that now, if I go to the villages and I'm talking in English, giving it out in English, it will not work. So what I did was, I'm so thankful to the BCH volunteers because it is not Google translated, but from scratch. We translated it, and now in the last 2 years, 2 and 3 years, we have it in 22 languages. For example, if I'm going here, this is Hyderabad, this is a slum area in Hyderabad, and this is in 2019 July. So, when I went there, you cannot imagine the way women were taking it. So they loved it. Now here also in another village in Assam, I gave it out in Assamese, in Bengali. So, so they were taking it, but another problem was there because they, even though they are adults, but they did not know to read and write. So that's why we made sure that the picture also explains a lot, so that when they see it, it will register in their mind. So that's why we kept it very simple. But also, I started to bring the children in the picture. I was so open. I told them, you have to take care of your mom. And that's why you see the small kids taking these papers. And I told them they were reading it to their parents because they went to the local school. They knew the local language. And that worked like magic because everywhere I went, they had my WhatsApp number. Even if they did not have a phone, the organizers, the Gram Panchayat, they had it. So any issue, so it's not that, we just go and we lecture, right? That will not work. So we have to take accountability. So I'm taking accountability of everywhere. Even today that I'm in this forum, anyone faces any issues, please reach out to me. I'll help, guide, counsel, take you to the next step in the best possible ways I can. So that is how, every day I'm getting these messages, WhatsApp, people are calling me that you came to my village, I'm from that panchayat. One of the women came running that they can feel their breast. What do we do? So we connect them navigate them towards the healthcare centers. I do follow-ups. I call them, make sure that they are getting the treatment. If they're below poverty line, they will have the government scheme where their treatment will be covered. So kind of taking care end to end. And that really was. And that's how we have saved so many lives in the last week, just because of this simple paper. Because it's like a Bible, it's like a Quran, it's like a Gita. Now, I'm not going to go into the details of this, but this also works very well in the US. Because for the men, even today, we do not have a screening mammogram, which is a protocol. So men love it, even many. So US also has the culture of different ethnicity we live here. So even though we live in the US, but our mindset still remains how we have grown up. So everyone loves it, even in the US, if they feel any issues, and it works so wonderfully for the younger women because that is the only way, because they do not, the screening is after 40, but those who have family history, they need to definitely go for mammogram or for checkup early. Now is the next challenge that I'm going to talk about, which is so important because many times mammograms, which is the gold standard for breast cancer screening, can also miss cancer. And this one slide, I'm telling you, in India, so many places when I presented, so many women, even in the US, came to me and said, I can feel a lump. I did my mammogram, it came negative. I said, just do an ultrasound, which is so simple. That because what happens is, so she is Dr. Nancy Capello, and we lost her in 2019, but she was the founder of RU10. So in 2004, when she went for her mammogram, it was a clean mammogram. But then she did her clinical breast exam, because in the US, we have to go for physical every year, which is the doctors check our breast. In India, when I requested many doctors, they told me, are you kidding me? We cannot touch a woman's breast when they're coming for some other concern. That is a real taboo. So I understood, many women doctors also told me, like, it's very difficult to convince to do this clinical breast exam. So that's where, again, the breast self exam works. But then with Dr. Capello, when she went back for her clinical breast exam, the doctor felt a huge lump. When she did her MRI, it was stage 3C. She was shocked because she just did her mammogram, and how did it miss? That's when she got to know that we have dense breast. She had dense breast. So what is dense breast? Dense breast means heterogeneous tissue, like this kind of white, it's fibroglandular tissue. So our breast is supposed to have fatty tissue. When we have fatty tissue, it appears as a black background. But when we have fibroglandular tissue or dense breast, it appears as a white patch. So many women, we have like this kind of white patches. Why are we talking about it? Because when we have a lesion, it appears as a white dot. So it's basically like, finding a snowflake in the snowstorm, and that's simply like our tumors can get missed. So what I tell everyone is, when you go for a mammogram, please ask your doctor, do I have dense breast? If you have dense breast, please go for an additional ultrasound. Do not miss that. You have to do that, because dense breast can mimic many times. Also, regularly, even when we go for mammogram, regularly do your breast self exam, because mammogram or ultrasound is once a year. Lump can develop any type at any time, and if it's an aggressive type, then it will grow very fast, because with the tumor, it's not like one type of tumor. There can be different types, like some may be like grade 2, grade with a intermediate aggressive. Grade 3 is very aggressive. It's very important that when we are having a lump, irrespective, we need to report to the doctor immediately. Now, the next concept that I'm going to bring it up now, what actually we did for the grassroots, like going deeper, is the village adoption and how it changed and what is the inception. So this was again 2018, 2019, 20th July. This is in Borakhai Tea Garden in Assam. So I just finished my session and everyone listened to me very nicely. But then this girl, there's an arrow over here. She started to cry. So I went to her. I said, what happened? You know what she said? She said, why didn't you come to my village last year? My mother just died. And she's just 18-year-old at that time. Because her mom did not know that a lump could be cancer, and she was so shy to tell anyone. So I told her, so, like, since this is a forum also on the leadership category and the transformation, I always tell everyone that, we need to just follow our heart, follow our emotions. I never plan anything strategically. I started with breast cancer hub. Now we have BCH wings cancer hubs. We have different types of cancer. So the way the circumstances are, we have to improvise accordingly. We cannot be judgmental about anything. We just have to be open-ended. Whatever comes, we have to understand how best solution we can give for this particular community. So what happened was, when I heard that, I felt so bad. I said, I could not save your mom, but no other moms will die from your village. And that's how I said, we are going to go door to door, explain, that all the screening methods. And that's how we are going to, take it to another level, go deeper. So that's the village adoption that we started. So how do we do it? And we are the pioneers to do this, model, to create this model. So first thing that I did was I collaborated with the local cancer hospital. Because even when we go door to door, we do the screening, we teach about breast self exam, but that will not function until and unless the suspicious cases, we take them to the hospital. So that's where we collaborated. This is in Northeast India, in Kachar, in Assam. We adopted 11 villages and we collaborate with Kachar Cancer Hospital. And the director is Padma Shri recipient Dr. Ravi Khanna. So we are in collaboration with them. So they know that we created the breast cancer hub card and everything. So how do we do that? So we go door to door. That's when last February, when I went to India, When my dad passed away, that was when we started the project in reality. So I started to go door to door, teach them how to do breast self exam. Then I realized one more thing. You see over here that these women, you can see what they are eating. It's tobacco. They're areca nut, supari we call it. So Northeast India, whoever come from Northeast India will know this very well, that our culture itself says that during puja, when we do any ceremony, is auspicious, pan and supari, which kind of like I'm trying to break that also, because so many lives we have lost because of tobacco. Everyone is chewing tobacco. When I'm talking about it, they have no idea that tobacco can cause cancer. It's not only in the mouth, it can go to any part of the body. It can cause cancer anywhere. Smoking tobacco, chewing tobacco, so because this particular liquid is going all across the body. And that's when we dwelled into oral cancer, head and neck cancer, colon cancer, because it goes everywhere. So that's how our village adoption works. So we go door to door, we give them the breast self exam card, we generated self oral cancer screening card, we do any suspicious cases, we take them to the hospital, because you have, like, one thing is they're daily wage earners, they're all below poverty line. For them, food is the priority, screening is not the priority. So they, even when we tell them you have this, they're like, no, it's okay. So we take them, means in the sense we cover the expenses. You can see here, every 15 days, we are taking the group to the hospital for further suspicious cases, for further treatment, for diagnosis, and then the counseling. We follow up with each case. So basically, that gives us so much satisfaction, and even like taking care of the expenses, in the sense that when they're diagnosed with cancer, at that time the government schemes will work, but till before that we have to cover all the diagnostic expenses also. Now, we had a lot of challenges because of COVID. The first thing was that many patients, because all the hospitals, they had their COVID protocols. You come to the hospital, you have to go through, the testing, and then, so patients were thinking that even when I go to the hospital, I'll catch COVID. Or many times they were so scared. The other problem was the expenses. The lockdown created this huge travel expenses, everything double, triple. But still, I'm so proud of our team, that who diligently, every day I would talk to them, and diligently they really, really did. And they helped to, like their testimonies where women are saying that I was having problems with the uterus, so they did pap smear, they didn't even know what all these things meant. From zero awareness, now they're 100% aware. And in fact, if their neighbors, also other villagers, have any issues, the women and men are saying, you need to do this, you need to do that. So what a proud moment it can be. And I feel like nothing better than a grassroots solutions that we can give, and we plan to expand to many villages in India too. Now, during COVID, as I said, right, because we are talking about COVID also. So during this door-to-door screening, we found that one day at 2 a.m. in the night, I get a phone call from our project coordinator, Sana Lembi, that, we went and we saw that people are eating rice with chili. Because even though the aids were given of the ration and all, because it was lockdown, but those were so interior, it never goes there. So that's when my head just spun. So now we have to give food. So in the same way, like, we didn't think that it was a cancer organization, because we just had to feed the people over there. So that's how we did the 5 replenishment of food. We went door to door, because for me and for our team, they are hardworking people. We did not want them to come in a line and we are going to give them food. We went to each household, put it on their doorstep, and we maintain database for every family. We have database, every member, because we are doing the screening there. Whoever, even today, even if they're having issues, we are providing them with the ration to the best of our capacity. Now, we also took another step last year during the COVID, is that the villages, when we were shocked to see that there were no COVID protocol measures. So we took the step, in the sense, did all the awareness with the COVID protocol. We purchased all the sanitizers. We kind of like, they were marketplaces. We took the stand, like, we brought all the women together. It was a women power, and we were so happy to see all the village women coming together. And we created this protocol in the local languages. We went to the market, and then, like, we kind of separated the people. We put all these arrows where they will stay. And you cannot imagine, those villages, they were hardly affected with COVID at that time. And then on the other side, we were also buying masks in India and providing it to them because, you can see like when the lockdown started to get released at that time, how they were still working. So that is how I think we kind of jumped in. Even in the US, we did not stay numb. So what we did was huge crisis of masks. We generated 1,545 masks in just 35 days, and we donated to 26 organizations in North Carolina, South Carolina, even in Chicago. So we had a team of 100 volunteers. And during this whole travel, like we were not allowed to travel. I was taking fabric from one house, giving fabric to another house. People were sewing at home. I was picking it up, shipping. We had this team formed. This is the charm of, I don't know what to say, humanity or volunteers, how they step up. Even they knew that, and that I think what we get at the end of the day is satisfaction, because we were providing masks to the healthcare workers, to the doctors, because there were no masks available. But the moment the masks started to come back in the market, we kind of stopped the project. So we go based on the necessity. Whenever is utmost needed, we just jump in. And now what we are doing is during the second wave, I know Aparna, you might have seen in the BCH India group. So we generated, I kind of saw that the information is all scattered. So anyone who needs help with any resources, you can go to Breast Cancer Hub website. If you scroll down, you will see that under the COVID-19 response, we have this Google Doc where we update all the resources from all across India. So anyone needing help, you will find everything at one place, and it's all verified, because we try to verify with our team as much as possible. And every day I'm getting like 10 messages from different patients in India doing one-on-one and trying to connect them so that whatever. I know we are not able to save many because how COVID is now with the second wave, but at least we are trying to connect, give them the resources, give them every possible way, connect them with the physicians so that the treatment is being done at the right time. Because with the delay, the progression, if it goes in the lungs with the inflammation, with the developed COVID pneumonia, it becomes very difficult to save them. But we are trying to work in that direction too. Now, so that was like how during the COVID time also the challenges we have faced and how we have worked on it. So I'll wrap it up in another 10 minutes. It's, I don't know, I think we have 30 minutes, right? 40 minutes. I'll just wrap it up in 10 minutes. Now, one more obstacle that I faced was many believed in India that cancer is contagious. So, cancer is not contagious. There's a woman I think it was in Guwahati. She came and told me that, you are talking about the villages. After I got detected with breast cancer, my friends started to ignore me. So that is how it is so bad. So that's why we have a tagline. We are talking about palliative care, which is not even mentioned. We talk about support groups, how when we are detected with cancer, is the utmost love and affection we need. Many families, like I'll show you this particular slide here, that many families, when I spoke to, they told me that, Lopa, no one even asked me what I went through emotionally when my hair was falling. Because whenever I would go and ask, like, okay, you have a cancer patient, you have a survivor, aren't you talking? They say, no, she will feel bad. She will never feel bad. You have to go and talk. And that's when I said, are you in a support group? They're like, what is the meaning of a support group? So that's when I thought, like, we have a very private, separate WhatsApp group where we discuss only the patients, the survivors from all across globe. We kind of help each other through their experiences. We have oncologists in the forum. So anyone, if you know, going through cancer, reach out to me. I will put them on the support group. And I also do one-on-one with the scientific counseling. Every time I try to guide and help with the newest clinical trial going on, and also, like, how we can work towards it. So that is how we work with the support group scenario. Now, when doing all of that, another challenge, as I said, was the financial constraint. So what we have done now is that anyone reaching out to me, like, our funding is not much. I'd not ask for funding ever. So if people feel it from the heart, they will donate to Breast Cancer Hub. But how do we manage that? So we have this a bucket for patient treatment aid. Anyone reaching out, we try to provide it to them, but also I'm trying to connect them to the hospitals providing treatment for the underprivileged sectors. So the any chemo which you get at 21,000, we can give it at 5,000 with the generic version. So that's why anyone reaching out to us, we make sure that we are not only providing the financial aid to the capacity we can, but also making sure that we are connecting them to the resources which they will get the treatment and they can complete the treatment with our guidance. Now, I'll skip this, but we talk about other things also about the risk factors and prevention. One more thing I want to bring it up, being a hardcore researcher, I cannot sustain, my brain will not function if I don't do research. So what I'm trying to do is, even in research, now I'm trying to bring the true scenarios and data by penetrating into the untapped sectors, doing the clinical data analysis, comparing the US and India, comparing the global centers, like where are we going wrong? Because people believe data. So that's when with the publication, we can help making changes in the healthcare policies in the future. And I'm involving the students equally, the youngsters equally. Now, this, sorry, I just mentioned about this. We are starting to create many early detection cards of all type of cancer. Please download it, because that is another way of saving lives, because many times, many type of symptoms we just miss out. So that's why I'm not going to go into detail. We created for all type of cancer, all authentic, with my students, India ambassadors, who is not only good for them, I'm thinking for their career growth also, and also how they can, contribute towards the community. And that's how I'm trying to bring the younger generation, which is my last section, because youth are our future. And I always believe that the younger generation, they will be the change maker, and how we can penetrate into their mindset, like what can they do for the community. It's not about career all the time. Career is important along with career. So my vision is to inculcate the art of scientific thinking and thought leadership, and also help with the career development, and motivate them how they can serve the community by spreading the word about early detection and prevention of cancer. So we develop many internship programs, community outreaches, so that you can see, like, with the ambassadors of India, I provide all the slides so that they spread it out in their network of family and friends. Because lifestyle is equally important, because that is the age when they go through tobacco consumption, healthy eating, junk food. So how cancer can be prevented, and making the youngsters spread it out in their network. So that is how, and I think that really is helping. And you can see how excited these young kids are to do all the outreaches. And I cannot be more prouder. I think my biggest satisfaction is also mentoring the students. And, when they roll out, they just, I cannot tell you how proud I feel of them. So that is how, through grassroots level, from all sectors, from poverty, from even in the urban sectors also, women are reaching out to me, because best of exam card works. Early detection of other cancer cards are working like magic. When they reach out, we navigate them towards the healthcare resources. If they're below poverty line, we make sure that treatment is being done, and counseling in the proper way, so that the correct treatment is done. And whatever the new era of medication is, I'm guiding them, telling them, you go and speak to the doctor, ask them this questions, because it is your body, you are the advocate of your body. And I cannot do this alone, because I can only do this because of everyone here, because each of you now can spread the word. Take it forward, about early detection, prevention, and anyone facing any problem, you can just reach out to me. I'll try to do my best to help. And saying that, I would really, really like to thank GCPIT, then GCCR, for this great initiative, and for giving me this platform to come in front of you all. And, like whatever way I can help the community, I'm always there. And I always say one thing, that I cannot do this alone. Together, only we can help save lives. Thank you so much. Thank you for listening to me today.
Thank you so much, Dr. Lopa. That was really amazing work you are doing through BCH. And I was getting goosebumps as you were explaining your activities, especially what you are doing during COVID time, and also for the BCH adopted villages, and also involving the youth and children in your activities. That is something really amazing. As I always tell you, I'm so proud of you, and I feel so grateful for the work you are doing. God bless you.
Thank you so much. Thank you.
It was really an eye-opening session. I'm sure our audience also would relate to what you were saying. I believe it's still a taboo to talk about breast cancer, and I also have lost a few of my friends and relatives to cancer. And I could really relate to what you were saying. And even I didn't know that men also could get breast cancer. I came to know that only when you did that session for us in Calicut.
Yeah, in Calicut. Yeah.
That was before the pandemic.
Yeah.
And thank you so. Yeah, tell me.
No, thank you so much, Aparna. And any questions from the forum?
Yes, I'm opening the questions I'm opening the session to the audience. And
I
before
want
that,
to ask something.
Yes, Anju ma'am, over to you. Yes.
Anju ma'am.
Lopa, hello, how are you?
I'm
That
good, thank you.
Great, I have listened to you before also. I just wanted to know one thing. I lost my sister because of breast cancer last year, Now, what her daughter needs to take protection of, like
Yes,
you said, it's not contagious. So, what
Yes.
I should advise her daughter?
Yes, absolutely. So thank you for bringing it up. So when I do a proper breast cancer session, I mention everything, about the genetics and all of that. But because we had 30 to 40 minutes, I just wanted to, put out like the important aspects. So Anju ma'am, I would say you also need to do the testing too. So you have to go for the BRCA mutation. So this is called the BRCA1 and BRCA2. So when in a family, if someone is having breast cancer or ovarian cancer, so we really, really need to do this testing, which is called the BRCA mutation, BRCA1, BRCA2. So the daughter, even the son, if you have a brother, everyone needs to do this testing. Because we always think of the daughter and the sister, but we always forget that the gene, the BRCA mutation, can be inherited by the males also. So many times, we have seen that if the BRCA is present, then those men are more prone to breast cancer and even prostate cancer too. So we have to be on top of it. So please I'm requesting your sister's daughter to do the genetic panel testing, and I would request, if your sister's daughter comes as positive, and if other members also in your family have different type of cancer, please do the genetic testing panel test, and you can share the reports with me, because I can read it through and I can explain the next steps, how you can take the next precautions.
Thank you so much, Lupa. But the only thing is, like, every year, there is an institute, the Cancer Institute by the government. I get myself tested with the mammography and all the tests, whatever concerned in that institute. In Delhi, it's in Bengali market. So like 2019 was my last, because 20 and 21, due to the lockdown, I couldn't go, and that institute is not open. But never too late, of course. They made my card also, and every year I go and get it done. Till so far, it's been really good. The reports are negative. I mean, then I think now it's time I should go one of these days and get them, take my card and get it done. I and myself and my husband, both of us get it done.
Very nice. I'm so proud of you. So Anju ma'am, do you know if you have dense breast, because you are getting your mammogram done, right?
I don't. They told me, the doctor there was very good.
Perfect. That's very good. Yeah, I'm so proud of you. I wish every woman in India, who can manage, who can afford screening, they need to take this.
In fact, I tell all my family members, like my in-laws, my sister-in-laws, everybody, yes, men I've never, but then now I'll start telling them also.
Yes.
But then,
even then, Anju ma'am, do the breast self-exam. Like for both men and women, we have it in 22 languages. Anyone can download it, and all our services are free of cost. So everything is like free. So please download and share within your network. That really helps.
I get it done. Thank you so much.
Thank you so much, Anju ma'am.
Thank you, Anju ma'am. Any other questions?
Yeah, thank you so much, Dr. Lopa. So attending session gave me more, informative actually. Otherwise, I was looking at all the webs, like LinkedIn profiles and all, but I didn't get clarity on that. So now I feel that, I'm from CMSME platform from Telangana. Probably we would like to associate in whatever way it is possible. I'll get in touch with you. I'm so excited because, last time I tried to do one session on this with some doctor, but it did not work out because none of the seniors were ready to attend it. they were even feeling shy. So probably I feel that, maybe through this platform, we can try to reach out. It's not only rural, but in urban, like in Hyderabad itself.
Yes.
Yeah.
I know, Miss Pravina. So thank you for bringing this up. So I was in Hyderabad for 1 week. You can't even imagine to so many places I went. I even went to Mehboob Nagar from Hyderabad, all alone from Mahatma Gandhi bus stand, so to do sessions there. And I have the breast of exam card in Telugu and also in Urdu. So I know that these are the two prominent languages in Hyderabad. So please, reach out to me, and I'm always there for sessions for the cause. So whatever way I can.
That's really wonderful. And now this time, last time, maybe the experience what you had would be different, but this time we are all there. Our complete team is with you from Telangana.
Sure. I mean, whenever someone was supposed to go with me to Mehboob Nagar, but that morning he said, I'm super busy. And I realized maybe he didn't want to travel in the, bus, in the no AC bus and in this heat in summer. So I was on my own. But I think, I know, but I think it's
Thank you so much.
Thank you so much, Miss Pravina.
Dr. Lupa, Pravina is one of our very active members. She's the chairperson of CMSB Telangana, and she is very active in women's groups. So I think that would be a wonderful idea to do a session.
Absolutely.
Yeah, thank you, Aparna.
Thank you, Pravina ma'am, for raising this. Yes, Marjan. Thank you so much. And anybody else want to ask any other questions? I think we don't have any more questions, and so let's conclude the session. Thank you so much. That was really an amazing session. As always, Dr. Lupa, I'm sure everybody who was listening to you would have found it useful as well. And the dear audience, on behalf of GCPIT, I thank you all for joining us today. If you feel this session has benefited you, we request you all to please go to our Facebook page and post your positive feedback there. And also to support us and the activities of Breast Cancer Hub and help us save more lives. If you want to connect to Dr. Lopa directly, please go to our website, gcpit.org, and you have an option to connect her through email. And if you feel you are an exceptional leader and you want to join us, please contact us at gcpit.org. See you tomorrow. We have another global leader from India, Ms. Geeta Goti, to tell us about how to tackle domestic abuse during the global pandemic. See you all tomorrow. Till then, this is Aparna G. Kumar signing off. Stay safe. Good night, good afternoon, good morning, whichever part of the world you are joining from. And Dr. Lopa, would you like to add something as a remark?
No, thank you so much. I look forward to conducting more outreaches at the grassroots, and so that together we can save more lives. Thank you.